Ms. Kay Walker, SEIU and other organizations. I just want to say to start out that the West Bay chapter retirees has decided to oppose both amendments at this point. We'll do this publicly. This amendment could change, so it's not written in stone. However, here's my suggestions in terms of being competitive with Adachi, which is what seems to be kind of a MO here. If you remove the business of the Health Service Board governance, completely take it out, the retirees won't fight that issue. We are bound and determined, most of us, to oppose this thing as it is now because of that item. A lot of SEIU people, even though PEC doesn't come up and say this, are looking at Adachi as having a better deal for actives in that he has a sliding scale going on in terms of contributions, and this amendment does not. Some of the people that are active, that are employed, will go for Adachi's amendment based on this. This is happening in SEIU. There's a lot of infighting. You may not hear it, but you eventually will see it during the campaign. Unless you remove, you could just adopt his scheme and put it in your amendment. Another point, some of us are really upset about the colors, even though some people contend it's not that much in terms of retirees, but many of us are 25,000 a year or under, depending on when we retired. My salary when I was a social worker was okay then, was 45,000. Now it's gone up to 70. It's a different, when you retire, that's a totally different outcome. So my suggestion is those three items do away with or change. Thank you.
Supervisors, my name is Lois Scott. I'm the immediate past president of IFPTE Local 21, but I'm here speaking as an individual. And I retired in 2009 after 29 years of service with the city in the planning department. Context: the city and county of San Francisco is San Francisco's, and the patterns of benefits and how Health Service Trust Fund is governed affect huge numbers of people across the city, especially the eastern districts and District 6, with constituents who work for the city or school districts. Citywide, however, we're proud of what we've achieved in the progressive health care. Healthy San Francisco, health benefits for hotel workers, for city workers. There are three big problems relating to fairness and honesty with this legislation, which can be cured by separating out the health services measure, which affects the governance of the Health Services Trust Fund, to allow disclosure and discussion with those affected. I think the problems, we've heard it called a consensus measure. It's not true in terms of the 100,000 beneficiaries and they're dependent of the Health Services Trust Fund. It's a multi-employer trust fund, and not all the employers and schools and school districts were there. And certainly retirees and their dependents were not there either. And rank and file members of the unions involved have not voted on this consensus package. Second problem is it's just not good government to hide measures taking away fiduciary protection of health benefits in a larger measure, changing retirement contributions. It's a disservice to democracy, it's a disservice to your own reputations for honesty, it's a disservice to your constituents. I urge you to do the honorable thing and separate the measure out. Thank you.
Good morning. Supervisor Kim, I wanted to introduce myself to you. I did the other day with Supervisor Farrell. I am a resident of District 6, and I voted for you. So I want you to know that, that there is at least one person that felt strongly about you. I felt very strongly, okay? following what the other members have said, I'm a retiree, I'm a retired city planner, and I worked for the city for over 20 years. I was chair of the Protect Our Benefits Political Action Committee. At the time, we sponsored and passed Prop C. Now, Prop C was put into place in 2004, and since that time, it has done quite well. We've gotten rid of all the complaints that the beneficiaries had, the number of the people not being live people to answer phones and so forth. I found this. We put out a flyer that said, yes, on Proposition C, for a safer, all of the reasons why. And lo and behold, Supervisor Ellsburn was there for Prop C. Now, what has happened in the time between 2004 and now? And I think it's because Supervisor Ellsburn has not been able to get his way on the board. And all that's going to happen, this change, is that it's going to be to the city's benefit, not to the retirees or the benefits. This is an absolute dereliction of duty for fiduciary responsibility. You cannot do that. We must take this out of this proposal. Thank you. And I would like to put this into the record.
Employee. One thing about this proposal for the restructuring of the health service system is it's basically designed to cut for cost containment. It's designed to hold down health service system costs. It's designed to benefit the public, but we also are part of the public. We're your neighbors, we shop at the grocery stores, we're human beings. And what it will do, it will have a detrimental effect potentially on people who are critically ill, people who are low income. This will work to the detriment of very vulnerable people. And for that reason, I oppose this proposition. Thank you.
Thank you.
For 59 years, and I'm a retired city worker after 20 years at General Hospital. I agree with the first three speakers. In my opinion, I think the city, in a certain sense, have been using a certain form of creative economics in their past agreements with the union for salary and benefits. Even my own union, 1021, could not adequately explain to me how come I'm receiving retirement benefits in lieu of the actual salary increase. And I had predicted to my wife years ago that that was a mistaken philosophy, and I guess the firemen and especially the policemen are finding out that all these so-called negotiations were basically backroom deals. One of my favorite subjects I study now is voodoo economics, and I have a feeling that the city and county of San Francisco, along with many municipalities, especially in the Rust Belt of the East Coast, have been practicing basically that sort of creating financing. Let's put it this way. It didn't work with Enron, it's not going to work with anybody else. Thank you.
The full board is a committee report, so it can be placed on the agenda. There would be no vote, of course, today at the full board. And then in the ensuing couple of weeks, because we don't have a board meeting next week, create more opportunity to gather this input and see if any changes need to be made on in July.
All right, so we will move forward this item with recommendation as a committee report to the full board. It will be heard, I believe, will be heard today and voted on Tuesday, July.
There will be no vote this afternoon, and Tuesday, July 12th, for further amendments to be made. If that happens, at which there would be an opportunity for members of the public to comment again. So no vote this afternoon.